Welcome to another edition of Politics and Right. My name is Egberto, Willies, your host. Today, I'm honored to have Dr. John Theis, a political science professor at a major college in Texas. We're going to be discussing healthcare. Specifically, we're going to discuss how healthcare is handled in a country that is humane towards its people relative to healthcare. And we're going to also talk about systems that harm. Dr. Theis, thank you so kindly for being here with us on Politics and Right.
Hey, my pleasure, Egberto.
Dr. Theis, tell us, first of all, as you know, in the United States, many progressives are fighting to have health care declared as a human right. It is hard to believe that a country that claims, many, specifically those on the right, that it is a country that believes in the sanctity of life, that this is a subject that isn't really close. Tell us a little bit about how healthcare is done in South Korea.
So, as you know, I'm over here. And what got me thinking about this topic, so a couple of years ago, I was here as a Fulbright scholar, and I had to get a chest x-ray. And so I went and got the chest x-ray, and I thought, this is going to cost me. And it cost me 20,000 won, $15
Wow.
for a chest x-ray. And then this year, I was working with the Korean university, and I had to get a physical and a drug test. So I went to a Korean hospital, got a full physical, drug test, all the blood work, everything. Cost me 55,000 won, which is about $40. So here I am, a foreigner coming to Korea, and the prices are like that. I mean, this is less than my deductible with insurance in the States. I really started talking to people about the healthcare system here, and I was surprised. I have not had a single person tell me they didn't like the healthcare system here. They said, it's cheap. We can go to the doctor when we want. There's no lines. And in fact, that was the key. There's very few lines. When I went and got my x-ray, it took about 20 minutes. When I got my full physical, I was there at less than an hour. It's absolutely amazing to me how good healthcare here is. And so I started doing some research about it. And, South Korea is number one in the OECD on healthcare access. And it's rated the second most efficient healthcare system, according to Bloomberg News. So they're clearly doing something right. And so having grown up here, when I was growing up here in the 60s and 70s, there was no healthcare system at all. People just paid cash. In 1963, they created the ability to buy health insurance. And then in 1977, they made health insurance mandatory for all people. And anybody that worked at a company with 500 or more employees, the employer had to provide the health insurance. And they coupled that with a Medicare program for low-income people. But that was people buying health insurance, right? Mm-hmm. So it was still a market-based system. But in 2000, South Korea created the National Health Insurance Service. And that took all the private insurance companies and combined it into one insurance company. It consolidated all these insurance companies. And then they simply dispensed with the insurance company and went to a single payer system in 2004. And so South Korea currently spends about 8% of its GDP on healthcare. Now that's compared to the United States, where we spend about 18% on our healthcare. And the way they pay for it is 80% of the total dollars come from employee and employer contributions. So every employee pays 3.825%, and every employer pays 3.825% So it's a total of 7.65% that they pay for their national health insurance program. And that covers 80% of the total costs. Then they have 14% or so as government subsidies, and then 6% from the tobacco surcharge to get to your 100% of the cost of healthcare. Now, some South Koreans also have private insurance. One thing that I noticed, South Korea is the plastic surgery capital of the world, right?
Mm-hmm.
So you would think with the government healthcare plan, those kinds of things would be non-existent. But in fact, they allow private competition. So there are all these plastic surgery clinics that are not covered under the healthcare plan, but people are free to go to it. I don't think a national health insurance program necessarily means you can't do other things, that you'll be that restricted. So there's still that kind of innovation. Lots of people are able to pay for additional services that aren't covered, but basic healthcare is covered through the national insurance program. They have complete choice of hospital and doctors. Like, I just looked through basically Naver, which is like a Google app here in Korea, and found the closest hospital and went to it for my physical. So there's no restrictions on that, which is much better than the US, where I have to always find in-network doctors and then get referrals to other in-network specialists, etc. So South Koreans tend to like it. I certainly find it preferable. I waited for both those appointments and the treatments combined. I spent less time than I typically spend for a checkup at my American doctor. And that's with a good insurance plan that's provided through my employer. And I have copays, right? Every time I go see the doctor in the United States. So that's basically how the system works. I think public opinion says they like it. The outcomes, the health outcomes, are really a lot better
than the United States.
Than the United States, yeah.
So let me ask you this.
Much lower mortality on things like cancer and diabetes than the United States, much lower women and infant mortality, much higher life expectancy than the United States. So
now, what you're saying sounds wonderful. And by the way, from a mathematical point of view, as an engineer, that's the only thing that I generally go by: absolutism in math. And when you take a look at looking at the problem from a mathematical point of view, it is clear that if you have a single payer and you eliminate all the different types of waste that you get from having multiple CEOs, multiple CFOs, multiple advertising agencies that has to try to sell your insurance product, multiple databases that maintain things, risk assessment, which if there's one risk pool, there's no risk assessment that is really necessary at all. What is the drawback? What could somebody in the United States who learned about the South Korean system say is the drawback of such a system?
Well, so I've been looking at that, and there's several drawbacks. I mean, the costs are, because every year the government negotiates with doctors groups on prices. So doctors complain about the prices, and they occasionally go on strike. Okay, at least some doctors do. So what I've identified as some of the problems is they have one of the lowest number of doctors per capita of any OECD country. So places like Norway, Portugal, Denmark, which are also, by the way, single payer systems, have double the number of doctors that South Korea has. But interestingly enough, South Korea has 2.5 doctors per 1,000 population. The US only has 2.8. So we're not that far ahead of them on that. Another big issue is that South Korea, about half the population live in Seoul, the capital city. The other half are scattered throughout the rest of the country. So there's obviously a bias towards Seoul and to big urban areas. So rural areas are having problems with keeping hospitals open and doctors. Well, once again, that is not particularly different from the United States. Okay. The final thing, and this I think is different, is there's a really low proportion of nurses because the pay is low. I think that has to do with several reasons. One is primarily this was a patriarchy for a very long time, and women were nurses. Mm-hmm. So the nurses' pay is low. So they have a low ratio of nurses, much lower than the United States.
Now, that said, given that they are spending 8% of their GDP on health care, and we're spending about 18% of our GDP on healthcare, it seems like all those problems that you talk about, low pay for nurses, less doctor ratio, etc. Even though with that low doctor ratio, their outcomes are much better than the United States, and sometimes doctors going on strike. It seems like because we have our pot of healthcare money is so large that those would be small issues to mitigate if we convert it to a single payer system, and one that we don't allow drug companies to gouge us. I mean, many would say, well, a lot of innovation would go because a lot of profit would be gone. But isn't it true as well? And this is a compound question. Isn't it true as well that a lot of the research and development that we have is actually already paid for by the government and universities that are funded by the government?
Absolutely. I mean, that's the thing. And these drug companies sell the exact same drugs in Korea or Canada or Mexico at a fraction of the cost that they sell it to the United States. I mean, we could have our healthcare expenditure and still have a better healthcare system because we would negotiate prices, we would not pay incredibly high drug prices. And I think one thing you left out is profit for not-for-profit, for hospitals, for their stockholders. We don't need to do that. I mean, and doctors' offices who deal with 8, 10, 12 different insurance companies have to have a person just to deal with those different insurance companies, their regulations, their different paperwork. All that would be eliminated. I mean, I've always said, if you don't want to create a national healthcare system, if you're opposed to that, then let's give more choice. Let's let people decide if they can take their private health insurance their employer pays them, they can buy on the marketplace, or they can buy into Medicare. Your choice. And employers, you can buy into Medicare for your employees, or you can buy private health insurance. People who support the private health insurance market don't want to see that as an option. They don't want us to have more choice because they know what everybody's going to do. Everybody is going to end up, it might not be immediately, it might take 5 or 10 years or 15 years, but people will move to Medicare because it's cost efficient and its administrative costs are only, I think, about 3 or 4%.
Yeah. Mm-hmm.
Whereas private health insurance administrative costs are 30%.
Yeah, I mean, it is amazing. I think what we need are more stories of reality. What I love with the way you presented the system from South Korea is that you pointed out how it is funded. You pointed out how it is successful. You pointed out your personal experience with it. You pointed out what the current polling is about how the people feel about that particular healthcare system. You pointed out that it only takes 8% of GDP, and you pointed out that the outcomes are far better than the United States. And lastly, you have actually lived in it. used it and saw its performance. It wasn't anecdotal. It is something that you saw.
Well, I think that's really important. I wish more Americans would travel outside the United States beyond the resorts of Mexico or Jamaica, because there are lots of ways to deal with problems in your society. No one country has all the answers, so we can learn from other places. But what I see a lot in the United States is people saying we're the best, reflexively, even when that isn't true, and saying we don't need to learn anything else from anybody else. And I think that's really dangerous. It leads to worse public policies, especially for those with the least power. People with power in our society, people with wealth, they live a different kind of life. But those of us that are middle class, working class, poor, those of us in the bottom 90%, we live a different life than that 1%. And things are not always how we would like them to be. And we can learn a lot from other countries and how they've dealt with some of these problems. We can learn things that they did well. We can also learn things that they did badly and that we should avoid.
Dr. John Theis, I think that's a perfect sentiment to end this discussion on. I think we've learned a lot. I think this is a message that needs to go through, especially now. And it is exactly what we intend to do. Thank you so kindly for once again having been on Politics Done Right.
Hey, it's my pleasure, Egberto. I'll come on anytime.